All right. Happy Tuesday. So, for pharmacology, I wanted to go ahead and do just a lecture on Chapter Five's PowerPoint since we did not have I didn't have the videos up and running early in the first week there. So, real quick, I did add this at the end of the video for chemistry, but I'm afraid some of you aren't watching these videos. So, I want to just give you a little bit of announcement for my seniors. Those of you that were slated to finish this week and head to extern on Monday, you are not going to externship. You will be placed on a leave of absence. So as soon as I put your grade in as an incomplete, and again, don't panic when you see your grade as an incomplete, all of you will get an incomplete grade. But that is because we cannot do the final exams or the skills checkoff. So everybody's going to get an incomplete. When campus is out, open and up and running, we will get all that taken care of and your grade will be changed. Externs, you're not going to externship, and there are two reasons. One, for not being able to complete the final exams or the skills checkoff. And the other reason why is most of our affiliates or most of our sites, especially the hospitals, are not accepting any students right now. So it's a waiting game. We don't know how long this is going to be. You just have to be patient. So you need to be on the outlook for, or the lookout for an email from Shara in Student Services. She will be sending you the leave of absence forms electronically for you to sign. We are going to be placing you temporarily through the 27th of April because that's when we're slated to come back. But if that changes, then you will obviously have an extension of that as well. So just make sure that you're checking your PMI emails multiple times a day. All right, Chapter 5, viruses. Pretty fitting for what we're going through right now. So a virus is a minute infectious agent that is smaller than a bacterium. It consists of segments of both DNA or RNA surrounded by a protein coating or a capsule. And viruses actually require host cells to survive or reproduce. Stages of viral infection, so influenza or the flu, different symptoms of that, tiredness, muscle pain, fevers, chills, headache. Patients at risk for complications include the elderly, patients with cardiovascular disease, renal disease, diabetes, asthma, and then of course our immunocompromised patients. So it's very similar to what we're seeing with this coronavirus, but we've seen some of the latest data coming out that pretty much anyone is at high risk right now. Still, especially our elderly and immunocompromised and patients with underlying health conditions, but they have been having patients who are normal, healthy adults passing away from this. So we need to be very careful. Annual vaccinations are recommended for those at risk for complications. So again, you know how I feel about vaccines. And especially the flu vaccine as well. Even if you get a strain of the flu that is not particularly covered in the vaccine, it still helps your body to recognize that it's a foreign invader, and you would not get as sick as you normally would had you not had the vaccine on board. Hepatitis is a viral infection. It's an inflammation of the liver. There are various forms of hepatitis from A through G, and the severity ranged from benign to serious. So we have vaccines for hepatitis A and hepatitis B, and we now actually have the cures for hepatitis C. HIV is considered a chronic disease, so it's important to monitor drug interactions for HIV patients. Remember, HIV medications are not curative. They do not cure HIV. If an HIV patient stops taking their medication, the HIV will begin to take over the body again as well. Regimens of HIV meds usually contain at least 3 drugs. So classifications of viral infections. So the duration and severity, acute, chronic, or slow. The extent of the viral infection depends on if it's a local viral infection. So let's say in the eye you have viral conjunctivitis, or generalized, the flu. That's a whole systemic. That flu virus strain is floating throughout your whole body. Latent viruses are viruses that lie dormant after an infection and later become active. So viruses like HIV, herpes. Okay, so with herpes, it's the same thing. There's no cure for herpes. You take a medication. So it puts that virus basically in a dormant phase. So that's why it's important for always to practice safe sex, wear condoms, because if there's no signs of active infection, it doesn't mean that they do not in fact have that virus. Immunoglobulin is a type of antibody that matches a specific antigen. It is produced by a host in response to viral antigens. It may prevent a virus from attaching to a cell, or it may destroy the virus altogether. Interferons induce production of hundreds of other proteins, which may disrupt the viral replication of the viral itself. It is host specific since they are encoded into the host DNA. Vaccinations. So exposing a patient to a component of a virus or an altered strain or viral strain in order to produce antibodies. So think about we don't vaccinate in the United States for smallpox anymore, but it's essentially the same concept. We introduce a component of the virus, so when we come in contact with that, our body knows what it is and can attack it and get rid of it, and not allow us to become sick from that particular virus or bacteria. So when later exposed to the actual virus, the infection does not develop because our natural defenses have been primed. Viral mutations. So this makes effective vaccine production difficult. So this is why we have new formulations of the flu vaccine every single year, because the flu virus mutates. Okay, so all of the hype and everything that happened in 2009 with the H1N1 strain, we had never seen it before. It was previously just a swine only flu, and it had mutated, and now it's a human to human. And so it's kind of like the same thing that we're dealing here with the coronavirus, but it's the coronavirus and the flu virus are two separate families. But you have to redevelop and reformulate these vaccines every year. Now with polio, there's only one strain. It hasn't mutated because we've done a good job of eradicating it out for the most part, except some of these anti-vaxxers. But in the most part, it's not mutated, and we haven't had any need or concern of seeing a different strain of polio coming through. Antiviral drugs. So the risk of toxicity to the host, since the viruses use the host cellular processes to function and replicate. So antiviral drugs tend to be a little bit harder on our bodies. They're formulated to prevent viral replication without interfering with a normal host cell. So antivirals are developed specifically to stop the viral or the virus from being able to replicate itself and not destroy our normal healthy cells. Therapeutic uses of antiviral drugs are for all of the herpes simplex 1 and 2, varicella zoster, which is chickenpox, or shingles, and then cytomegalovirus, which is actually a herpes virus of the eye. Also influenza, and then RSV, which is respiratory syncytial virus, which typically only affects either our elderly or our very young babies, especially. So when you hear it's cold and flu season, it's RSV season, these are viruses that actually attack the respiratory system. Anti-herpes agents, you have acyclovir and famciclovir. These come in either oral dosages for some, both creams as well. Valtrex, the Valcyte are also provided for anti-herpes. Anti-influenza, so we have amantadine, is used as both prophylaxis and treatment of influenza A, and then Tamiflu. Remember, with these anti-influenza agents, when you're going through these and looking at these for the Tamiflu and all of these other ones here, that you must get these drugs and start therapy within 48 hours of your first symptoms onset. So if you start running a fever, you need to get to the doctor and get that Tamiflu in that 48 hours. Otherwise, they're not going to give it to you, because by that time, it's not going to work. Okay? HIV and AIDS. So we use a drug class that is antivirals, but it's a little bit more enhanced. And what we do is we have a drug class specifically called antiretroviral drugs. And a retrovirus is what HIV is. It means that it uses RNA as its genetic material. So reverse transcriptase is the enzyme that retroviruses use to become part of the host's DNA. That's how it infiltrates our system. HIV is a retrovirus that attaches to the receptors on the surface of CD4 cells. It uses a reverse transcriptase to convert its genetic material from RNA, which is what the virus is, to DNA. AIDS, acquired immunodeficiency syndrome, is a syndrome which occurs when patients have advanced or severe forms of HIV. So when we first started seeing these cases in the 80s, these patients were already in the AIDS stage. They were in the final stages, because typically HIV can go for years without having any signs or symptoms. Antiretroviral drugs are difficult to tolerate due to the side effects and different drug interactions. Most of these drugs can be combined in a cocktail, which attacks the viral replication in multiple or different stages. And that's what helps keep the HIV almost undetectable in the body. Must be taken chronically. Again, this is not something that they're going to take 30 days of or however long. If they stop taking the HIV medications, the HIV will start replicating again and take over the body system. There's different groups of antiretroviral agents. We have the NRTIs and the NTRTIs, and they inhibit basically the reverse transcriptase, again, which prevents the formation of the DNA copy from the viral RNA. Gives you a list of those. We're not going to go through the drugs specifically. You can do that through your PowerPoint. So protease inhibitors, they decrease the formation of the protease enzyme, which cleaves certain HIV protein precursors necessary for formation of new infectious virions. So it does not allow, or it prevents that protein synthesis that some of these viruses need for replication. It prevents that from happening. Fusion inhibitor prevents HIV from entering immune cells. So instead of it invading our healthy cells, this medication is used, a fusion inhibitor is used to stop that from happening, to leave our healthy cells alone. Integrase inhibitors block the action of integrase, which is an enzyme needed for HIV to reproduce. So HIV needs a host, right? It needs a human host or whatever type of host to survive and be able to reproduce. These medications are preventing it from reabsorbing or using certain enzymes from our body that allow it to reproduce. So responding to exposure of HIV. So as healthcare workers, even in pharmacy, we have to be very careful about our risks of exposure. Our risk of exposure is much more less than, let's say, a nurse or phlebotomist, anyone who's doing any blood draws or starting IVs, but it's still something that you should think about. You know, we're up on the floors, you know, we are seeing sharps containers and all of these things. You must be very careful in how you are interacting with staff, how you are helping clean up certain areas, or if you're coming in contact with any used needles. So Healthcare workers are at risk because of the exposure to blood and other bodily fluids, and then inadvertent needle stick injuries, meaning a nurse is trying to start an IV line, the patient starts convulsing, she slips, and when the needle comes out, it pokes her. So she's had an inadvertent needle stick, and he or she is at risk for whatever diseases that the patient may have. So post-exposure prophylaxis can decrease the risk of infection by 80%, and it should be started within 2 hours of exposure. So in the hospital that I worked in, we actually had what we called an HIV kit, and this was kept in the emergency room and every floor on every unit. So if if a nurse or a healthcare worker had an accidental needle stick from a patient, then they would go in, pull the HIV kit out, and start the medications right away. They still have to go over a period of time and have their blood drawn to see if they've been infected or what they've been infected with. But they've shown that as long as they start typically that prophylaxis medication in that 2-hour window, then most will be negative. Combining antiretroviral medications. So the main advantage to that, prior to there being combination drugs, every HIV medication was single. So some patients were taking 6 to 8 tablets multiple times a day. So you can understand how that would get frustrating. They could forget, they would get confused. So the drug companies started combining a lot of these into one pill, so going from 6 to 8 to maybe taking 2 or 3 a couple times a day. Disadvantage is fixed doses are unsuitable for unstable patients. So again, it's just kind of a case-by-case scenario. It gives you examples of what some of those combination medications are. So immunization is the process whereby a person acquires immunity or resistance to an infectious disease. So there's 2 types of methods for acquiring immunity. Passive immunity, which means antibodies are transferred to an individual. This occurs naturally during pregnancy or occurs artificially through the administration of immunoglobulin. Immunoglobulin is a blood byproduct. So kind of like how we talked about those, the doctor and nurses that were brought back from Africa in the 2014 Ebola outbreak into the United States, that doctor actually survived the Ebola on his own. He was able to fight it off. They used his blood to create the immunoglobulin to transfuse into the other 2 nurses and then the 1 nurse that it got exposed in Dallas, and that's how they survived. Active immunity is when the individual makes their own antibodies. So this occurs naturally following exposures. Okay, so if we're exposed to the same bacteria and virus over and over and over again, eventually our body's going to say, oh, I know what you are. It's not happening today. Or it occurs artificially through vaccination, and that's why vaccinations are very important. Live attenuated vaccines mean that they use live but weakened pathogens to induce the immune response. Inactivated vaccines means they use pathogens that have already been killed. Immunization schedule. So the source of the schedule is actually published by the CDC, or the Centers for Disease Control and Prevention. They set the schedule on what vaccines should be given to children at certain parts of their life, and also adults. Vaccines for children most will lead to a lifetime of immunity, and boosters can be given for continued precaution. So, for example, when I started working at the hospital, I didn't have my shot records readily available, so they drew titer levels, which is a blood draw to see how many antibodies I had, particularly for the B, hepatitis B, and the MMR. My B was fine, my MMR was very low. You know, I'm an older person, so I got the MMR very, very long time ago, so it was suggested that I got a booster of the MMR just to help protect myself in the hospital setting. Hepatitis V vaccine is required for all hospital or healthcare employees, and most facilities will also require the flu vaccine. So common vaccines, your role as a technician, screening patients to see if they need any vaccines, or if they're here for vaccines. We complete the necessary forms. We make sure the patients complete the necessary forms. We will store and stock the vaccines. We check the temperatures of the refrigerators that store our vaccines. And then in some places, we can actually draw up the vaccines for the pharmacist and have it ready. Currently in Arizona, we do not give vaccinations, only the pharmacist can, but they're slated and expecting that to change eventually as well. So it gives you the big list of what the common vaccines are. And as you'll see, like typhoid, yellow fever, Japanese encephalitis, these are not ones that we typically give here in the United States unless there's someone going overseas for travel, military servicemen and women, that type of thing. So travel vaccines recommended when traveling from areas of low infection rates, which would be the United States, to areas of high infection rates, should be given 2 or more weeks prior to the travel time to ensure that the immune system has enough time to mount a sufficient response. Travel clinics may be located in clinics or pharmacies and provide immunization and advice about what vaccines are necessary. I don't think we have any travel clinics here in southern Arizona, so my suggestion there would be to contact the public health department or the Pima County Health Department, and they can tell you, okay, if you're traveling to this area, these are the vaccines that are recommended, and that's actually probably where you're going to go to get those vaccines. Common side effects of vaccines: fever, headache, upset stomach, local site pain where you got the injection, and typically managing those side effects is using Tylenol for about 24 to 48 hours after the vaccines are given, especially in small children. Patients who receive vaccine information sheets and sign a consent form as required by law. So we cannot just give a vaccine, they have to sign a consent form. Healthcare personnel that are trained to give vaccine administrations must also be trained in CPR. It's the first time someone's getting that vaccine. We don't know how they're going to react to it. They could have an allergic reaction very quickly. We need to know how to be able to help them. Most vaccines are to be stored in the refrigerator or the freezer with storage temperatures strictly followed. Again, this is why I have you checking the temperature logs every single day when you come into class. Cautions and considerations. When you're drying up a vaccine, they must be used right away and not refrigerated again if that vial reaches room temperature. If that vial reaches room temperature, it's no good. You've got to throw it away. Must be used within minutes to hours if it's reconstituted. Advanced mixing of vaccines is not recommended because if something changes, they decide not to give it. It's a waste of a medication, waste of a vaccine, which are typically not cheap, and a waste of cost for the pharmacy. Vaccines are not to be mixed in the same syringe with other medications. So you can't draw up a vaccine and draw up a different drug into the same syringe. It's got to be totally separate. Complementary and alternative therapy. So andrographis may reduce symptoms and severity and the duration of influenza if it started within 36 to 48 hours. Side effects include chest discomfort, headache, nausea, and rash. Colloidal silver is used topically and orally for infections. Some side effects include neurological deficits, and if it's into higher concentrations, kidney damage. And elderberry, this is something you've probably seen a lot, either advertised or kind of poking around the social media here lately and during the flu season, because it may be used for influenza when it's initiated within 48 hours of the symptoms. Now, the idea behind the elderberry is kind of like the echinacea. It helps boost your immune response. And that's it. We have finished out Chapter 5. So you will have an assignment associated specifically with Chapter 5. Now, some of these questions, book, PowerPoint, and if you're not able to find it in there either, like with our other assignment the day before, storage requirements, that is in the micromedics. You access that through your PMI online library. If you have any questions, be sure to email me, and if not, have a great rest of your day.